And welcome everyone to our first webinar on Humanist Chaplaincy, Canadian Milestone. I'm Anna Popovich, Program Director with Humanist Canada, and I'm pleased to welcome an exciting panel of guests with us today who will focus on the nature of chaplaincy, the role of Humanist chaplains currently working across the country, and the launch of the Chaplain Accreditation Program. Today's moderator is our own, very own Nicolas Bruzzone. He is a member of Humanist Canada, the Ontario Humanist Association, where he was a marriage officiant, and British Columbia Humanist Association. Nick has also served on the board of directors of Humanist Canada. He moved on from that role to focus his volunteer efforts exclusively on establishing a credible Humanist Chaplain Accreditation Program as the first chair of HC's Chaplaincy Committee. Nicolas holds a BA in economics and an MA in public ethics. And just a reminder to our listeners who are joining us right now, if you have a question, please submit it with the Q&A tool at the bottom of your screen, and the speakers will address it during the Q&A period. Thank you all for joining us. It's great to have you here. And Nick, please take it away.
Wonderful. Thank you very much, Anna. I see that I'm unmuted. Should be good to go here. So thanks to all of you who've joined us here today. I'm really happy to be here to discuss the launch of this Humanist Chaplaincy Accreditation Program, which you may notice some of us refer to as the HCAP as we speak today about it. So this program, it's a formal accreditation process that provides oversight to humanist chaplains in Canada so that they can provide professional, legitimate, and trustworthy support to Canadians in major institutions and organizations. Many of us here today are, of course, self-identified humanists, and we've seen a need for this type of program for many, many years. I know that I have. For over a decade now, I've hoped for something like this. What makes this especially exciting, though, is that there are millions of Canadians all over the country from all backgrounds who stand to benefit in their lifetimes from an expansion of access to spiritual and emotional care. And it's very satisfying to be working towards that goal. So before we move on to our headline discussion, I'd like to express some gratitude to the outstanding team that has worked very hard to bring this program to fruition, and to the many humanists at Humanist Canada, Ontario Humanist Society, and BC Humanist Association, as well as local and regional groups who have all laid the groundwork and have provided support, encouragement, and inspiration over the years. Thanks to all of you. And lastly, to the many wonderful, selfless, religiously affiliated and faith-based chaplains out there, thank you for the compassionate support you've been lending of yourselves for hundreds of years. We look forward to working alongside you to make the lives of the people with whom we share this world a little bit better for all of us. I would now like to introduce you to the first accredited chaplains under this program. Shortly, I'll be telling you a little bit about each of them, and then we'll roll into a question-based discussion until the top of the next hour, at which time we'll be opening up the floor via the chat function, please, to some of your own questions until 4:15 Eastern time. So first of all, on the panel today, Dr. Marty Shoemaker. Marty is a humanist chaplain at Kwantlen Polytechnic University at the Richmond, BC campus Multi-Faith Center. Marty is an active member of the BC Humanist Association, Humanist Canada, and the American Humanist Association. Marty is also a semi-retired psychologist and a retired member of the social science faculty at Douglas College. An avid reader, Marty is currently working on a co-authored book on inclusive humanism for university audiences. Next, we have Mary Beaty. Mary is a former teacher and public librarian and has been serving as the humanist chaplain at the University of Toronto for over a decade. Mary is a member of Ontario Humanist Society, American Humanist Association, Humanist Canada, Humanist Association of Toronto, and she's a supporter of Humanist International. Mary represented the American Humanist Association at the United Nations in New York, working with both secular and faith-based groups on human rights and social justice issues. And I'm sure you all know Martin Frith. He's the current president of Humanist Canada and Humanist Canada's first members chaplain. Martin is also a licensed humanist officiant, providing a range of secular services. He holds a Master's of Divinity. He has a private practice as a clinical fellow with the American Association of Marriage and Family Therapy. And lastly, we have soon-to-be Dr. Srishti Hukku. who is in the process of completing her doctoral studies in population health and medical anthropology. As a humanist chaplain, Srishti serves the community at the University of Ottawa. Srishti is a lifetime member of Humanist Canada, Humanist officiant and supporter of American Humanist Association, Humanist UK, Humanist Australia, and Humanist International. And Srishti is keen to explore ethical, existential, emotional, and equity-based issues with all of you and all of us here today. So for the first question, we'll make it short and sweet. Shorter could be harder, could be easier. But I'd like to just start with, in one sentence, if each of you could please tell us what does humanist chaplaincy mean to you? Srishti, I'll start with you.
Thank you so much, Nick, and thank you to everyone who's tuning in today. So happy to be joining you, whether you're here in Canada or joining us from abroad. I'd like to start with this question by answering that for me, chaplaincy really signifies caring for human beings first and foremost. I'll turn it over to Marty.
Marty, you're muted there.
Thanks, Ritzy. I'm very excited about having this webinar and the launch of HCAP and our opportunity to actually get chaplains out there in Canada. So to me, even though the word humanist chaplaincy is a bit of an oxymoron, I like to think of myself as a secular advisor or a facilitator and guide with a secular worldview.
Great. Mary, over to you. Oh, no, there we go. Now you're on. Perfect.
All right, everybody. My computer just crashed, and so I'm using my phone. And cross your fingers because I'm roaming.
So humanist chaplaincy in one sentence, if you can, Mary. Yes.
It means being a presence, being a humanist presence in the institution, and speaking up for being a voice. And then I was thinking of a quote just a second. We all love Terry Pratchett. And one of my Terry Pratchett favorite quotes is, "Sin is when you treat people like things." The end.
Thanks, Mary. Martin.
I could probably say this in one word, but I'll use a few. And that is my definition would be humanist companioning. And I see my mission in life as to be with people at pivotal points in their lives.
Perfect. Thanks to all of you for that. So Mary has been working as a humanist chaplain at U of T for over a decade, as I mentioned. So she's got plenty of experience, although not with sort of in the framework of an official accreditation program. She's been doing this work and applying it for a long time. So I'd like to ask you, given your extensive work in chaplaincy and in that community, can you tell us a little bit of some of the key milestones in the history of chaplaincy? I know you're a history buff as well. So.
Oh, you mean chaplaincy itself?
Yes, chaplaincy itself.
I'll try and be brief. For those of you who don't know, the word chaplain comes from a cappella, which is a cloak. It's an Italian word. And it refers to Saint Martin of Tours, who, of course, was a Roman soldier, and he cut his cloak in half and gave half to a beggar, and changed his life from being a soldier to someone taking care of people. And eventually, the chapelain became attached to a chapel in a way, but it's a military term. And it means the person attached to the military, either running the chapel or running the services which supported the military. Later, of course, it also hospices. So it became later attached to other institutions like churches and eventually universities and places and hospitals. So it's always been related to service and always been related to a rank. We're having a meeting next week in the Chaplains Association at the university to try and find another word other than chaplain, but it's hard for us. The word is distressing to the Indigenous community and to other some non-Western faith traditions, but it's hard to find a word which means the same thing, which means institutional rank. And that's what we're talking about today. So the important thing to remember is that if you become a chaplain associated with an institution. I'm a staff member, for instance. I assume you are too, Marty and Srishti. I am bound by the memorandums of agreement. I'm bound by the ethical practices. I can be disciplined, dismissed, all that sort of thing. Even though I'm a volunteer, I have to work cooperatively and inside the auspices of that institution. So I think if we just remember that it's a military term, originally, it has to do with service. It has to do with what Martin just said about support and care and all that sort of thing, but also being the voice of support and care in an institution whose role may be something else. So, right?
Yeah, perfect. Thanks, Mary.
Bye.
And does anyone else have anything else they'd like to just add there to that about the history at all?
Well,
Yeah,
I think there are
absolutely.
three
Nope,
social.
go ahead.
Go ahead, Shritzi.
Go ahead. No, please go ahead, Marty.
I think there are three social movements that we can add to Mary's historical kind of narrative there. And that is that back in the 30s, ministers and religions began to see the impact that the social sciences were having in caretaking, and particularly in psychiatry, psychology, and social work. And so they started the clinical pastoral education discipline. And it's almost 100 years old now. And so that began to become a way that people could express their religious service. And then I think another really important thing that happened in Canada is that, in the late 70s and finalized in 1982, the Charter of Human Rights and Freedoms was finalized here in Canada. And as a result of that, it gave rights for all Canadians to have access within their worldview and their religion. And as a result of that, an entire multi-faith initiative bloomed in all institutions because the government was saying, we need to supply this for everybody. That was huge. And that happened in the 70s and 80s. And then as Martin will tell us shortly, we know that our society here in Canada is secularizing, and very much so since the 90s for the last 30 years. And so there's an entire growth of secular population, and we need to be available to them.
Thanks. And Srishti, you were going to say something? Yeah, go ahead.
Yeah, thanks, Nick. So sorry for stealing a bit of your thunder here, Martin. But I do want to highlight a few important notes as well. So chaplaincies have evolved from being primarily Christian to include other traditions as well. So there are now Hindu and Buddhist chaplains that exist. There are also Sikh chaplains, even in Canada. And I think really exciting news from a North American perspective is that in August 2021, Harvard University named a humanist chaplain, Greg Epstein, as the head of all of the chaplains at the university. So this marked a really huge shift in terms of, from my perspective, secular progress in the West. And we have in Canada's major institutions people who are already functioning as chaplains. So there's a lot of room to grow here.
Thanks, Srishti. So I guess, Martin, you're the president of Humanist Canada. And under that mandate, we're expanding access for non-religious, we stand up for, in many respects, non-religious rights and secular separation of church and state. And so I'm wondering if you could speak to that a little bit about why this is specifically chaplaincy, humanist chaplaincy is important as part of that.
Sure. Well, I think just to piggyback on some of the comments that have already been made in terms of the increasing secularism in Canada since the 60s and literally around the world as well. So if we look at, Statistics Canada, their National Home Survey in 2011, which had reported that over 7.8 million individuals have identified themselves as having no religious affiliation. And that really represents 23.9% of the population. And if we compare that to 2001, 10 years previous, where that percentage was about 16.5%. So this is higher, if you can imagine, it's higher than the cumulative number of individuals. For example, 2.7 million who identified themselves as Buddhist, Hindu, Jewish, Muslim, Sikh, traditional spirituality, and as other religion in the same survey. So that's Stats Canada. And then if we look at the Pew, some Pew research, which was done, excuse me, in July of 2019. And so many of you may have already seen this, but the Pew research had identified, 5 elements of what was happening in Canada. So for example, of that 5, a declining share of Canadians identify as Christian, and an increasing number of people who identify as having no religion. Again, Canadians saying that religion's influence in public life is waning. That relatively few Canadians engage frequently in traditional religious practices. And 2/3 of Canadians actually say it's not necessary to believe in God in order to be moral or have good values. So I think that those, the trend is that obviously we're becoming increasingly secular. This is the hour, I would say, for Humanist Canada and humanist organizations to be embracing the void that's out there around creating the space for humanists to be recognized. So I'd also, want to acknowledge that we're seeing in various other ways that legislation doesn't recognize, in some cases, the non-religious. So we'll see where religious or faith groups are specifically identified, and humanist or people of no traditional faith group are left out of those numbers. So it really is imperative for Humanist Canada and other humanist organizations to be identifying. So it's clear that this isn't an absence of presence, but we actually represent a sizable majority of Canadians. And so it's, as I say, it's time for us to be moving forward. And one of these ways is certainly through our chaplaincy program. So, and I don't know whether any of my colleagues want to jump in.
Okay, thanks so much, Martin. Let's get into some of what this work is like. So Marty, you've also been a chaplain for many years at university, and I'm wondering if you could tell us a little bit about the types of issues that you discuss with students who come and see you.
Yeah, I think that the university track, which 3 of the 4 chaplains that are present in our panel today are in university settings. Mary is at the University of Toronto, and Srishti is going to be starting University of Ottawa. And I'm at Kwantlen Polytechnic University, which has 5 campuses here in the Vancouver area. I think that because the history, as Mary told us, is very much tied in to the Catholic Church historically, and then later to Protestantism, with the first Protestant chaplaincy being in the University of Cambridge in the 13th century. So it's really been almost 7 centuries that universities have embraced the idea of some kind of spiritual counsel or some kind of this form of enlightenment that is usually uses the word spiritual. In the university where I am, and Mary and Srishti can add their 2 cents to this, and that is that I find that the students don't come to me for spiritual counsel as such. I think that there are many other issues that they're struggling with, and almost all of them are mental health issues. They're lonely, they're stressed out with school. It's a time of great developmental and identification. They're moved away from their families. They're questioning their tradition, their philosophy of life. They're experimenting sexually. There's all kinds of changes that happen during this time. And so I really feel much more in the role as a psychologist, just listening to their story, then I really feel as any kind of a spiritual advisor as any sort. Now that's different, I'm sure, in the other institutions where people are in a different kind of needy embrace. But for me, I find that the university setting is an incredibly open environment for us to be working, because this is a place where you have this entire change that Martin is talking about between 18 and 25-year-olds who are questioning the big meaning questions, and they're starting to form things for themselves. They're not necessarily following what their grandparents or their parents or even their small community somewhere in upper Canadian, or if they're an immigrant coming from another country. And it's a great time to have these questions about that they come in and wanting to know and saying, well, you know, I was raised this, but you know, I've been taking this class in philosophy or in anthropology, and I'm beginning to wonder whether that makes sense to me or not. And I'm not interested in proselytizing. I don't want to turn them necessarily into a humanist. I just want them to explore it and do that with a very client-centered approach so they can work out their answers in their own way. That's an important part. Well, I think when you're in a university setting, that may be different when you're a hospital and you're dealing with death and dying and illness, and even in the prison system where you're dealing with, you know, people that are incarcerated, and we know that people change their faith in prison about half the time from where they went in to when they get out. It's very different in a university setting. And I think the last thing I'd like to say is that we have a hard time sometimes being recognized in universities because the students are so busy. They have many things on the go. We sometimes have to reach out to them. It's a little different than when people seek you out because they're in a really difficult place. Whereas in an institution like a chaplaincy in a university where they're taking a full load, working part-time, and they don't have a lot of time. So we often set up student groups for them. And that's one of the ways that we get to be sponsored in a multi-faith center. There actually is a student group that, like the Secular Student Alliance.
That's great. And I just want to mention on the proselytizing piece. So in public institutions, of course, you know, in a multi-faith setting, that is something that we, of course, expect, you know, the religious chaplaincies are not proselytizing, and we're bound by the same, you know, rules, and it's part of our code of ethics also. So I didn't want to just highlight that. Thanks so much. And Mary, so you've been in university chaplaincy as well, and I was wondering if you could share some of your experiences and what students come to see you about as well.
Can you hear me?
Yes.
All right, I'm going to try and be fast, but I'm going to talk in a couple different levels. If you are a U of T person, as I am, you may remember early days when you have various religious colleges like Trinity and like Vic and Knox, and they, at one point, you got scholarships and you ended up in St. Mike's, you ended up there through your faith tradition. And most of those big endowed colleges have chaplains. They're usually endowed and they're paid by the college itself. Then they opened up Innis and New College and UC and all those other colleges. And that's where a lot of the non-Christian religions ended up. So the Jewish tradition ended up mostly at UC and Innis and all the other places. There was just an article in the Varsity last week saying, what is it with all those other schools? They aren't as nice. They don't have as much, their websites are bad, that sort of thing. Because traditionally they were underfunded. Most of those places have chapels, they have places for people to meet, they have resident staff who are paid. The Hillel now has a big hall, the same way Newman House, the same way that Catholics have one. So those big traditions have large places to meet and identify. The large Hindu and Muslim component at U of T has taken over Hart House basically because it has big rooms, and they've also taken over the Multi-Faith Center. We had a problem last month because the Hindu chaplain has made the first time in Canada that they can have a fire altar inside a building at U of T, and he wanted to come in and light some do some prayers, but the Indigenous community, which doesn't have a place, has taken over the Multi-Faith Center during COVID.
All
So there was
all these interesting politics that happen, of course. But anyway, yeah. So
the important thing about them is this: we have 42 chaplains. They come from all sorts of traditions, including pagan and all sorts of things. So I'm not unusual myself.
yes, it's a diverse atmosphere there.
A lot of my work is working at the management and the university level among my chaplains to develop policy, to protect students, to provide, making sure there's enough mental health resources, all that sort of stuff. So a very large proportion is to get along well with others and work with an enlightened way on policy. As far as people approaching me, yes, they do come and ask. We set up groups, we do that sort of thing. The kids would rather talk about pop culture than ethics these days. Some of them, the graduate students do, and I've appeared on panels, I do all that sort of thing. However, at the University of Toronto, I just want you to understand this, the mental health resources are severely stressed. And if a student speaks to me or anyone else, and if we are concerned about their mental health, if we have all sorts of training, we take these courses, if we are concerned that they might be a harm to themselves or to others, we have to refer them to a whole process at the university. Yeah. What happens is they are removed from the educational stream for a while. A decision is made to manage this. A large percentage of the students that the chaplains take care of at the university are, of course, international students. If they get referred to a mental health referral, things happen. They might.
Yes. Mary, thank you so much. So
they might lose their scholarship. They might do anything like that. And that's what's happened with the suicides.
Yeah. No. So providing that first frontline.
You have to make sure that you are totally aware of the policies of the university, and you cannot counsel people. You cannot do any of that without doing it in the institutional framework where you are in agreement and you are watched. So we have to make very sure.
Absolutely.
That we are working that way, and less of the time is spent in individual listening.
Yeah, no, you highlight. Thanks, Mary. You highlight the important, some difficult challenges and risks that are inherent to this, and so certainly that's part of the training, and that's why. Yeah, thank you, and that's why our program is so important as well to buoy that and ensure that everyone's. So Srishti, you're new to this. Can you do you have anything you want to add there?
Yeah, absolutely. I'll be really brief. I wanted to share that my expertise is obviously in population health and medical anthropology. So it's been interesting engaging with a few of the students over the last month or so. My real area of expertise is sexual and reproductive health and LGBTQ+ rights, et cetera. And so that has really been the focus of the kinds of issues and concerns that people have broached with me. So having concerns about, what pronouns they should be using, having concerns around how do they share these kinds of things with friends, families, et cetera. Where do they get reproductive health counseling for abortion needs or other needs that is not stigmatizing, is not harmful. And so that has been really great to be able to turn some of my research into a more practical, accessible option for sexual and reproductive health issues on campus. And I guess the other thing that people are generally struggling with is autonomy. It's amazing to be out on your own and to strike out, and yet there is a lot of pressure that comes with that. And so that's one of the other areas that we've talked about, especially as things have transitioned with COVID and students are back on campus more so than they were in the last 18 months. I guess I'll just add lastly that I think in the National Capital Region, it's really, really important that there's finally a humanist chaplain on campus. I'm really excited to work collaboratively with the other chaplains that are on the team. Later this month, we'll be having a discussion about what have different worldviews or different traditions learned about themselves and their interactions with folks in a virtual environment during the pandemic. So those are a few of the things that I'm working on. Thank you.
Great. Thanks, Srishti. And so, Martin, your role is really as a chaplain to Humanist Canada members. That's a new program that's just come out, really launched with our accreditation program. And I'm wondering if you could tell us a little bit about the types of issues members might have approached you about in the last couple of weeks.
Right. Well, it really is very new. I mean, and before I do that, I just wanted to acknowledge is for over almost 20 years, I actually was a chaplain under other auspices, and that was in healthcare. So many of the themes that we're talking about, and just to give you an example, I'm thinking of somebody who was in, I spent a bulk of time in rehab, and an amputee and neural rehab unit. And so if you can imagine somebody who's lost a limb, and so again, there's a whole medical, social dimension out of this that other professionals are dealing with. And then at the heart of this is, how does one's sense of self-definition change when they have lost a body part and are beginning to identify themselves and work through this? And so these are the kinds of existential crises or conversations that people are looking for. So more recently, and because we actually haven't done a formal launch to say to Humanist Canada members, we have a chaplain, that's something that we're going to need to develop a rollout plan for. But to give you an example, as recently as this past week was a referral from a Humanist member who had chosen a maid death. And so it was interesting. She had commented how many people in her circle of friends were kind of keen to proselytize and to save her at the end of her life. And so she really wanted to have a humanist presence at her bedside. And so I really had the privilege of witnessing really her last moments. And was one of two people in the room, myself and the physician who was actually completing the MAID process. And so what a rich and powerful experience in being able to hold hands with this individual as she really literally breathed her last breaths. And so the next step in all of this will be to craft a celebration of life in which, again, her values will be reflected and represented. And so this journey is ongoing. And what was interesting for me, I've been involved with supporting her roommate, friends that have known her, all of whom have never been through an experience like this. So this is, I think, at the heart of what chaplaincy is, being able to witness to another's journey.
Thank you, Martin. Thanks for sharing that. That's moving just to hear about it. And I'm so grateful that all of you are able to provide this kind of support. So as we talk about sort of, the places where chaplains are going to be, employed and contributing, Srishti, I'm wondering if you could tell us a little bit about the types of institutions where chaplains could work.
Absolutely, and would love to have others chime in after I give a bit of a brief overview. So we've spoken a little bit about universities, but I think it's important to remember that there are other institutions where humanist chaplains can provide services and have been doing so quite successfully in other parts of the world. So you have the military, you have the prison system, and then you have hospitals, as Martin just alluded to. So I'll give you a very quick overview of each of these. So in the military, chaplains have been serving since really the Middle Ages, over 500 years of chaplaincy. And most recently, from a humanist chaplaincy perspective, we've seen big successes in both the Netherlands and in Australia with integrating humanist chaplains into the organizations. At home with the Canadian Armed Forces, there are a range of options for service as a humanist chaplain. So You can serve either in the regular force or the reserve force. And all of these different sort of versions and training requirements and education requirements are clearly outlined on their website. Fortunately for all of us and for those who might be interested in serving with the military, we have really taken the time to develop a strong relationship on that front. And so we can help potential applicants to better understand and navigate what is otherwise possibly a very complex process. So let's move on to prisons. Prisons are, a beast of their own, and chaplains play a really vital role in the prison environment. We know that the role in the prison dates back to the Victorian era, and in 1823, chaplains existed in British prisons. So in Canada, once the Kingston Penitentiary was built, we had Anglican clergymen that were serving here. In April 2020, Humanist Chaplains won the right to work in prisons in the US. And Humanist UK has also seen a lot of success with non-religious pastoral carers providing support in about 20% of the prisons across both England and Wales. So really exciting. And then in the hospital, probably one of my favorite stories is that in the UK in 2018, there was a bit of what I would consider a landmark victory for Humanist Chaplaincy. Lindsay Van Dyke, who was 28 at the time, was selected to become the head of the chaplaincy service for the National Health Service, which, as you can imagine, is a huge job. And there are also humanist chaplains serving in hospitals in other countries all over the world. And again, as Marty and both Martin alluded to, that it's a very unique role where people are often receiving difficult diagnoses, families are there for end-of-life care, et cetera, et cetera. So each of the different institutions that we're talking about today really has its own unique challenges and benefits depending on what folks are interested in. If you're interested in any of these areas, don't hesitate to contact any of us on the committee. We're happy to talk to you more about what that could look like, and we're happy to work alongside you to actually try and make some movement in Canada in some of these institutions.
Marty, I know you're working on some of this in your book as well. Can you speak about, do you have anything you want to add?
Well, Srishti has outlined the 4 institutions that have historically really had chaplaincy, and some of them go back, many hundreds of years. I think that there is also a growing interest among both for-profit companies and also nonprofits, NGOs, to provide services that they often call spiritual care. But really what it is, it's really dealing with ethical direction within the company, some of the policies, sustainability, some of the diversity issues. And so they feel that some kind of an institutional or possibly consulting chaplain, they call them chaplains, or they're called care workers sometimes. And there is a group that's providing this, Nick, in the United States, and they have now started to move into Canada, into private institutions as consultants. And I think many of us who have worked in companies and or who have an interest in the culture of companies and policies and social justice issues that corporations can take a stand on might find this a very interesting avenue, although we have no humanist chaplains doing that as such.
Wonderful. So I'd like to pull on a thread here. It's one of my questions, but I noticed it's a question as well that Marianne Farah put in the chat. And I guess if we could just talk a little bit about how we distinguish chaplaincy specifically from other sort of well-being services like psychotherapy or social work. And so, Marty, did you want to speak to that to start?
Yeah, Mary started talking about how important the institutional guidelines are when you're in a university for this. A very step-by-step approach. And when you become a chaplain in a place like University of Toronto that has a long history, they have a protocol that you need to follow. So you are not a psychotherapist as such, and they have a counseling group that you can make a referral to. And you also have off-campus resources that you can refer to. So I think we don't view ourselves as psychotherapists, even though I did that for 40 years. I think the issue is that you have to be separate out that you're not providing professional services. You are assessing, you're listening, and often you make a referral based on the severity of the condition. The other thing that's different is that a psychotherapist is someone who very specifically, as the end goal of all of this, is for a person's mental health to be improving. When you're a chaplain and in a multi-faith center, they define that as also developing a closer relationship within their worldview to whatever God or rituals that they are a part of. So chaplains here at the university that I'm at often provide some kind of spiritual counsel, and the line is very gray at times. So there has been a merger between psychotherapy and chaplaincy. And I think that we have to be very careful about it. But at the same time, if you come from a mental health background, you've worked as a social worker, or you've worked in some of the counseling role, you can be really in a really good position educational wise, just like Martin, who has a background in marriage and family counseling, to work. It's just that the spiritual care aspect has to be added into your repertoire.
And Mary, you don't have that sort of formal psychotherapy background. What are your thoughts on this? Oh, you're still muted there, Mary.
Okay, this is very important. There are very important legal barriers here. That's why we can't find another word other than chaplain, because any other word like counselor has legal implications. We had a big discussion at OHS years ago when Dr. McCabe, who was a licensed therapist, was our chaplain, about whether officiants should have insurance to protect them, especially if they were doing counseling. I have to be extremely careful about referrals at the university. As I mentioned, there are not only the procedures that are set up, but I have a very strict memorandum of agreement as well. So yes, listening to someone like you would listen to anyone and helping them as we all do is really important. But you have to make sure that you have A, you know exactly who to refer people to, but B, you know how backed up the system is and how people are in great distress because the university or the institution does not have enough counseling, and yet you can't step in and do it. So that's a very difficult situation, and you should be very, very careful unless you're Martin and you have a license, unless you are very clear, I am now speaking as a therapist or a clinical psychologist, and I am not just speaking as a listening ear.
Absolutely, yeah. That's a risky territory. And even for those who have the background, of course, you still have to separate, right, where you're employed by an institution or serving a specific group, or having a private practice, which are two different things. Martin, what are your thoughts on this?
You know, I mean, I think in some ways that what may look similar to the outside, you know, in terms of counseling and support, is different. So I think it's really helpful to be able to identify that. So, you know, if you're talking with a social worker, you're talking with a chaplain, so things could look similar, but they have totally different outcomes. So if we think about many other professions, that there are outcome measures that they're looking for. And one could say, you know, that's maybe true about, you know, an assessment process in terms of spiritual care. But I think for me, the huge difference is, and it's part of my model of companioning, is that, you know, this is really about being able to be present to another on their journey without being prescriptive about, you know, where that needs to take them, without providing advice, but being a support. that's very intentional about helping people connect with their own inner resources, for example, and to come to an understanding of what, you know, their journey, what this transition is all about for them. So I think, you know, centrally, we have very few places in the world or in our culture, for example, where you can actually be able to share something of your journey and have somebody witness it without being able to offer advice, offer perspective, but just be able to listen. And there's something that's profoundly, and I think that for me, that's one of the central roles that chaplains provide, which is not to say it's not interactive, but being able to hear people's journey in a way that, you know, physicians, there's a specific outcome. If you're dealing with OT or PT in the healthcare setting, it's a very specific outcome. If people are looking to interpret their or understanding, and that was one of my roles with the wider healthcare community, was being able to interpret one's individual customs. So for example, if somebody had a particular belief system that that people assumed because they may have been listed on an intake as being coming from a faith tradition, but in fact, practically speaking, didn't embrace that. It had little meaning for them in their lives. So these are the kinds of roles that I think that are really central to what chaplains do.
Thanks, Martin. Srishti, was there anything you wanted to add real quick if you wanted to? Okay, so next, so just to delve into that a little bit deeper, what are some of the tools that you might rely on as humanist chaplains to guide people who come in and see you, or like sort of what sort of approaches do you take with people that approach you? Marty, go ahead.
Well, I think probably the most important tool is probably something you got all the way through from your family up into your professional life, and that is your emotional intelligence. And that is your ability to hear and feel what people are feeling and relate to them in a way that shows you understand. And that's emotional intelligence. And some people have to really work hard at that. They didn't get that within their family context, or they're born with a kind of a very analytical brain, and it's very hard for them to emotionally relate. So that's the tool that I always look for in a chaplain, is their ability to relate to people, both themselves, their own self-observance, and the emotional depth of people around them. So that's probably the number one tool. And the other one that I found very important, Nick, is the fact that if I'm working in a multidisciplinary setting, I need to understand the faith traditions of the other chaplains and of the students where I am. I need to understand the history of Sikhism. I need to understand something about what Buddhists that come to our school from China, what do they observe? What do they believe? So when they come to talk to me, I know something about where they're coming from, rather than just being a secular psychologist or someone that is only, you know, read David Hume in the philosophy of how religions all fail. So it's very important that we be able to understand them, empathize with them, and help them build those resources within their own worldview. So those are the two things.
Thanks, Marty. That's great. And just as we're approaching sort of the top of the hour, so we'll just cut you guys off a little more. Mary, how about you though? This is what's your approach that you take when people come see you? You're on.
Yeah, no, I know. What I wanted to say, can you hear me?
Yes.
Okay, this is very quick. I'm trying to be quick. We do a program, I'm changing the topic. We do a program every year where we work with all the other chaplains, with all the medical staff at U of T, and we do an entire training program on death and dying. And I'm part of that, everybody's part of that. And the point is to get the medical students to understand that taking care, Martin, of a dying person takes a team. And it takes the social worker, and it takes the everybody, the doctors and everyone. People forget about the chaplains. We have to remind them the role of the chaplain, which is the spiritual part. And don't be afraid of the word spiritual. My approach to people who come to me is to find out, of course, where they're coming from, and to try and understand what they view a chaplain as. Just like you can't get the doctors to see what a chaplain is, because they feel you should just call the social worker. So the last person that came to me, her father was given a terminal diagnosis. He was going to die. She called me to say, what does this mean? Will he just turn to atoms? Will he turn to compost? Where will he be when he's gone? What is that? So we can all do that, of course, you know, with 5 hands tied behind our back. We can talk to them. We can find things to talk to them about and listen, and then follow up and keep in touch with them. That's the kind of personal thing that you do. But in the bigger scale, I think our role as chaplains is to remind the institution and the other chaplains what a humanist is, to live your life as a humanist, to be involved in social justice, in climate action, in supporting communities, in saying, this is what an ethical, spiritual life looks like for me, a non-religious person, and be that presence at the Humanist Roundtable, at the hospital, wherever you are. You're a voice representing the humanist view of life with your colleagues and the community, I guess.
Thanks so much, Mary. Martin, anything you wanted to add there about the approach you take?
You know, it's probably very Rogerian for the therapy-oriented folks out there, which is really is to say client-centered. And when I did clinical pastoral education, you know, the model was Anton Boyson was the pioneer, and the whole focus was on seeing patients, clients as the living human document. And so everything referenced back to them. And I think that that's at the heart again, what I see as being part of the humanist or chaplaincy focus with working with individuals. So my number one tool.
Wonderful. And Srishti, anything you want to add there as well?
Yeah, so I guess for me, a few words come to mind. I think it's important as an immigrant to this country to really say that, you know, first and foremost, my approach centers on being anti-oppressive and being trauma-informed, and really just trying to keep in mind that the challenges that people are coming to me with will be informed by a whole host of sociopolitical, economic factors that are very different than my life, my worldview, etc. And so to try and create as much as possible a non-stigmatizing space where people can actually share their truth and they can feel heard in what it is that they're sharing. And then, of course, as everyone has already said, referred to resources as required.
Great answers, all compelling, different, and great perspectives. Thank you. So we're just wrapping up soon. Is there any final thoughts that anyone would like to add here in the last few minutes?
I'll jump in, Nick, if that's okay. So,
sure, go for it. Yeah.
D'après moi, c'est important maintenant d'indiquer que nous avons fait cet webinaire seulement en anglais, mais nous sommes très contents d'avoir des candidats qui sont bilingues, qui parlent d'autres langues, obviously French. I want to also say that you know, I feel it's incumbent upon me to do a big shout out to those in the LGBTQ+ and BIPOC communities. Please feel free to reach out if this is a career that is of interest to you, something that you're considering. And I thank all of the participants who have joined us here today. I thank you for being part of this movement, and I invite you to really lead the movement by joining us. Thank you.
Any other final
Nick, I'm
thoughts?
sorry, if I may jump in and ask a question, could you please tell us specifically about the Humanist Chaplaincy Accreditation Program? What's required to become a Humanist Chaplain? And I believe we have a question in the Q&A about that as well.
Sure. So first of all, you know, I would direct everyone to the website, humanistcanada.ca, and you can, you know, read all the details, including a enlightening 11-page policy document under programs, chaplaincy, and then under there is Humanist Chaplaincy and become a chaplain, or just more information about our chaplains and some frequently asked questions. I also want to mention, if there's any questions here that we don't get to today, we will, you know, as relevant as may be relevant to many, we will like to expand our frequently asked questions. So we'll be expanding and evolving the website. But just roughly speaking, first of all, you need to be a member of Humanist Canada, which is a small annual membership fee. What is it, $60, $50? I think 60 for a family. Martin, is that
$40? A
$40.
bargain of $40.
That's right. It's a charitable donation to become a member of Humanist Canada. And then there is, a 1-year membership period of membership required, and sort of a self-evaluation, self-assessment. Like, is this really what you want to do? Is this really, we don't want sort of spur of the moment decisions being made about volunteering somewhere and interacting with people, and or potentially a career. This can vary from a part-time volunteer to university to a full-time, military officer who deploys with an army regiment. So, or in the Navy on board a ship, or with an air detachment as well. And then, of course, it's that institution. So you need to have an institutional component. And so where do people want to work? So all these things sort of need to be identified. And ultimately, to be on par and legitimate with other sort of chaplaincy groups, we do have the requirement for a master's level degree in the field that is relevant to this type of care and outreach. And then we have an application process. It's a $100 fee to apply, and you can ask questions to us again through the website. Humanist Chaplaincy, Humanist Canada Chaplaincy certification at humanistcanada.ca is the email address. hccc@humanistcanada.ca. Please ask questions. And then, of course, there's going to be a screening process, independent study module. There's an interview, and then training. And this is new, so some of that is still being developed. But we are growing that and expanding, and it would be done, alongside the institution that is sponsoring people as well. Ultimately leading to an accreditation. And then there's a membership period, and you're looking right in front of you at 4 of the mentors who would be, helping people along. I myself am not a chaplain, so I would not be a mentor, but that's roughly the process that's required. And again, it's all viewable on the website.
Nick, and maybe you can put the website in the chat. Just
Sure.
type it up. So, yep, thanks.
Okay, perfect. That's a great idea.
Yeah,
So,
and I was going to say, it's really simple to anybody to go to the Humanist Canada website, go to programs, do the drop down to chaplaincy, and the link is there.
Perfect. And chat. Okay, I'm going to fiddle with that later, because next. So any final thoughts? We've got a couple minutes, but we do have some questions in the queue, so I'm ready to move on. Just a quick line from anybody before we move on to the attendee questions.
Well, I just think if people are in our audience that want to be an ambassador in some way for humanism, and they want to be involved in some kind of care and support kind of thing, I think chaplaincy is a great path. It's not going to be easy because, as Nick said, you got to have a master's and usually a relevant area, but it is an area that I think offers great fulfillment if that's in your kind of future idea.
Perfect. Okay, so we've got some questions in the queue. I'm going to move on, barring any of you waving here, panelists. No? Okay, so one very quick question that's just pending from before. Martin, I think you'd mentioned an American company that's moving into Canada and taking on people as chaplains. I didn't quite catch that, but someone was asking the name of the company.
It's called cares.org. And it basically, they call themselves counselors. They don't call themselves chaplains, but they get into the corporations through some kind of a spiritual counseling rubric, but it's called cares.org.
Perfect, thank you. Okay, so next question here. So when the public hears chaplain, many associate that specifically with religion, and therefore they may not be, as motivated to access that service. And what are best practices that humanist chaplains can put in place to ensure that people are aware that everyone can access the service, no matter the worldview or spirituality? This is to any of you.
I think that's such an important question, and I think it's really incumbent upon us as humanist chaplains to say that our worldview does not in any way prohibit or limit our capacity to be present and available and to care for those with different worldviews. In fact, it's an integral part of being a humanist. It's an integral part of recognizing the humanity in others. So I think that's a great point. And if people have suggestions on how we can share our message in a way that is more accessible to those who don't necessarily share our worldview, I think our committee would certainly be open to that, and I would certainly welcome that. But I think that in and of itself speaks to the essence of being a humanist and centering the humanity in others.
Hello, I'm having a meeting next week. I'll let you know what the result is. But the last decision made by the Campus Chaplains group, our chair of the group is a pagan. So she's the pagan chaplain. Now, if that brings a smile to everybody's face, we are considering listing yourself as, because the word chaplain, once again, is a rank. So the American Humanist Association allows people to call themselves chaplains who are not necessarily chaplains. I think we should be very careful about the use of that term because it's associated with an institution. But the pagan chaplain and the others are going to describe themselves as pagan chaplain, Jain chaplain, Sikh chaplain, humanist chaplain, comma, and then counselor, whatever they wish to use as defining words after. So think about that, but I'll let you know.
Great. Martin?
You know, I think that there are other organizations that we're working with. So, for example, the Canadian Association for Spiritual Care Providers, and historically Christian-based, but they have broadened their umbrella to be including people of other traditions. And right now, I'm working, trying to engage them about broadening the umbrella so that it will include, in fact, humanist tradition. And I think other ways that we could all be mindful of, every one of us as humanists in the organization and on this call, to be thinking about the organizations that you may be engaged with. And I think to be asking those questions, who looks after the humanist worldview? So if you're in hospital, making that ask is that you don't, if your preference is not to be seeing somebody of a religious denomination, is that to be asking for a humanist chaplain. And so I think these are, again, very simple, practical ways that we could be doing in all of our organizations, and that would continue to move this along.
Thank you. So on the one side of the spectrum, we talked about sort of psychotherapy and that kind of counseling. And here's a question, just kind of in the other side of the spectrum, if we could distinguish chaplain from life coach.
Yeah, I think coaching is a very new area. The word's being used now. Books came out in the 90s and in the early 2000s. A life coach is a paid position. It's a private practice endeavor. Some corporations provide coaches to their senior executives, but most of them are out of the institution. A life coach has very specific objectives that you are trying to move the person towards defining what they want to accomplish in their life. And although there may be a little overlap with coaching and chaplaincy, chaplaincy is a very different, specific, narrower area dealing with the big questions of life, not just what do you want to do with your life in terms of its steps, that what a life coach does. Plus, there's very little licensure with coaching, whereas we do have very specific accreditation processes for chaplaincy.
And the only thing I might add to that is if we can think about life coaches and other professional relationships, they typically are contracted to do a piece of work. And as I think about chaplaincy is that this tends to be without a contract, and our work tends to be much more temporary. So as a chaplain, we move in and out of people's lives as the need arises rather than being a permanent. So the idea of a chaplain, for example, would be is that you're not replacing somebody else's spiritual care person if they belong to a tradition. It might be helping people through a specific transition. So it tends to be much more short term.
Perfect. I'll move on to the next question here. Please describe the training needed to become a chaplain. What are the courses involved, the cost, the amount of time, and what is the pay like? So I touched on a little bit of that, but Srishti, did you want to talk about the training a little bit and just sort of what we have envisioned?
Yeah, absolutely. So there's different layers of training, as Nick has alluded to, and as you can read more about through the website. But essentially what we're hoping to do is that as we get the first round of those who are accepted, we're hoping in the winter to be hosting a multi-day virtual session where we're able to really hone in on what is humanism, what is humanist chaplaincy, what are the skills associated with humanist caretaking, and we're hoping to deliver that in a way where it's collaborative, we're all learning together, and it's as interactive as possible. In combination with those virtual sessions, there will be opportunities to do a little bit of homework at home, so opportunities for reflection on why is this the right career choice for you? If someone was to ask you about how to explain what a humanist chaplain does, how would you go about explaining that? So there is a combination of in-person, live, collaborative work, and then a little bit of more of an opportunity to delve a bit deeper and in depth into some of the reflection pieces on positioning yourself and making sure that this is an integrated part of your offering.
Great, thanks, Srishti. So just to go back to some of the other elements of that question real quick, I can answer as well. So the application fee is $100, and then there's a annual accreditation licensing that's $350, and at this time anyway. And that matches the officiant fee as well. And the time it takes, it depends on the career as well. It really depends on the career, and as well as the pay. Of course, many positions are volunteer, and I think in the Canadian Forces, for example, once you're trained and serving, a captain or lieutenant in the Navy would be about $80,000 a year from there.
I can give some information on pay for paid chaplains. The range is, if you are a senior organizer of the chaplaincy, say for a large hospital, is around $75,000 a year, but that's very few of those in Canada, and it goes all the way down to where roughly you can be paid as a part-time employee providing services, say like in a hospice, around $25 an hour. And so it has a big range, and it's the senior positions, full-time, often supported by the religious institution, although hospitals do pay for this, although it's sort of under scrutiny right now. And now in prisons, there are only two denominations that are involved, and that's Catholics and Protestants, because they are no longer paying other prison chaplains.
Interesting. Okay. So Mary, you had something you wanted to say.
I want to tell you that 80% of the chaplains at the university are volunteer only. And they are volunteers because there is no institution to pay for them. That's when I was talking about the Victoria College and all the other colleges, right? Two, so many of our chaplains in the group also work as hospital chaplains, as hospice chaplains, and at CAMH and other places. They're all trained. They have 2 or 3 other master's degrees in counseling and therapy. They all operate not from their own spiritual tradition. The ones that I know are Buddhist, Hindu, and Unitarian. And they are, of course, trained not to operate from their faith tradition at all. and their compensation is very low.
Got it. On to the next question. So Michelle, I think we've addressed sort of the first part of that question mostly, but the second one, do I need to become a chaplain to be a humanist officiant? Martin.
Do you need to become a chaplain to be a humanist officiant? If I've understood, and of course the answer is no, that these are related but separate pathways.
Sorry, I put you on the spot there, Martin.
No, that's quite fine.
Yes. So yeah, and so the officiant training as well is a requirement for the chaplaincy. And I would also just direct people, so I did put the link in the chat. And if you go to that website, the fourth paragraph, there's a link there, Humanist Chaplaincy Accreditation Program available here. That's a highlighted link. And that is that, 10 or so page policy document that does get into the details of what's required and the core competencies for a chaplain. So anyone who's listening, who's interested in becoming a chaplain, please have a read of that document if you're seriously interested, please. In practical terms, we're looking for some more information on the vision of the program. And so, yeah, that answers that, Michelle Ballo. Yeah, I'd recommend have a look at that chaplaincy accreditation program. You can email us if you have any more specific questions, I think.
And if I can just add,
sure,
Nick,
go for it. Yeah.
So a shout out to Michelle, but also to others. If there are topics that you're interested in hearing about with regards to chaplaincy, don't hesitate to shoot us an email, and we can try and respond to those needs, whether it's a one-on-one conversation or whether we need to do some additional presentations.
Absolutely, and this is a new program. We will still be evolving it, expanding it, and refining it. So, from Jackie, I don't know if anyone knows the answer to this. Marty, are prisoners in solitary confinement allowed access to chaplains?
No, they do not. But before they go in and when they leave, they are given access to chaplains. The problem about it is that most chaplains are not spending just a lot of time at the prison. Most of them are holding meetings on either Saturday or Sunday and then helping them when they leave the prison get into a community. And the problem right now is that many prisoners don't really know how to contact a chaplain because there's so few of them now in prisons, and that they have a lot of bureaucratic steps they have to go through to actually make contact and become a prison chaplain right now. It's been cut back due to funding. My understanding is that outside of solitary confinement, however, they do have access to the meetings and also on a one-to-one level consultations, but that is a minor part of it. It is more the meeting function that they attend on a Saturday or a Sunday or a Friday night, and they go to those meetings.
Wonderful, thank you. So I think we've answered the questions here, and we're just 3 minutes shy of our time. So I think perfect opportunity here to close it off. And I will just I'd like to thank everyone for coming and chiming in. Please don't be shy, and if you have any sort of more specific personal questions, just reach out to us through the website. The links are there. There's further information that I think will answer some of your specific questions as well, or we will are more than happy to provide those answers. It's your support through webinars, donations, and volunteer work that makes all of this possible. We look forward to continuing a dialogue with all of you. And we hope to see some applications. We want to grow this program. That is ultimately the goal of all of us meeting today, to share information so that we can get more chaplains serving across Canada and helping people where they are. So I'd like to just turn it over just to Anna for any announcements on future webinars, and that closes it out for us. Thank you so much to our panel today.
Thanks, Nick.
Thank you.
And thank you, panelists, for this wonderful presentation. Congratulations on your work and these initiatives. And please stay tuned for further announcements about the chaplaincy program. And thanks to our audience for joining us on the call today. I would like to extend an invitation to our next event, which will be a virtual coffee chat about recent events and current situation in Afghanistan with Faika Talon, who is a poet, public speaker, educator, and activist. And this will take place on Zoom, as always, on Sunday, October 17th at 2 p.m. Eastern Time. You do not need to register for this event, so you can join directly through a Zoom link, which you can find on our website, www.humanistcanada.ca. And finally, if you would like to become a member of Humanist Canada or support our programs or both, please visit our website as well. Thank you all again for the lovely event, and have a great evening.
Thank you so much.
I know.
Bye.